Hey there, welcome. It is good to have you with me today. Today, we are going to be talking about pupils as indicators in an eye analysis. For those of you who watch this as a recording, please take a moment to like the video, share it, drop a comment, and subscribe to my channel. It helps to make the videos more visible to more people. It helps that algorithm thing that we're always talking about. And if you're interested in learning more about iridology, if you're a health professional and you want to take a course, you can find my website, iridology.education/course-info. All righty, let's see where we're going here. And just a moment. I am looking to see if I am sharing my screen. I am not. Let me share my screen because that would be an important thing to do here. Iridology is so much easier to do when you can actually see the images. This is actually one of my students. She sent me this early on in her coursework. I just wanted to say that as a new student who has worked in iridology before this and is a certified iridologist through another teacher, I have learned more in the first 2 lessons of your dynamic iridology course than in all of my previous iridology training. I'm so glad that I decided to sign up. I know that after taking this course that I will be able to offer my clients the best and most up-to-date knowledge. Thank you, Tricia, for that. All righty, I have lost my control panel screen. That's not cool. Just let me get it back so that I can keep tabs on you as well. Oh my goodness. Okay, I've got too many things open. Do you do this? Do you have too many things open on your computer screen and you lose things? I've totally lost. There it is. Okay. Sorry about that, guys. Little technical faux pas there. All right, now we are ready to go, except now I can't see my chat box. Oh my, that's what I was looking for. Okay. And this, there we go. Now we've got it. Okay, sorry about that. Got it all together. This information that we're going to share today is for your education only. It's not meant to diagnose or prescribe. We never diagnose or prescribe through iridology. Iridology is an assessment tool. You are responsible for whatever happens for using this information. That is your responsibility, not mine. All right, so today we are going to look at the pupils. When we do iridology, we often think that we're focusing on just the iris. And, decades ago, the iris was all we looked at. We didn't look at anything else. And then people started doing research and we've added in sclera. And now we've got even more information. And now we're looking at pupil. So as we look at all of this, let's put it into perspective. The iris is inherent and genetic. This is what your parents, grandparents, and great-grandparents blessed you with. This shows us where your potential strengths and weaknesses are. So think of this as your epigenes, your epigenetics. We get to see inside your code here. The sclera is what you're doing with it. Where do you have congestion? Where do you have issues? Where do you have things going on right now that should be addressed? And the pupil is a little bit both. There's some genetics here, but there's also a lot of situation, a lot of what you're doing to yourself. So when we are looking at pupils, the first thing we want to do is assess the size. When we look at the pupils, if they're small, we say they have meiosis or they are meiotic. Now, in truth, when we're looking at pupils, we always want to make sure that we are looking at them in natural average room lighting, right? That's really important because from a photograph, we've got so much light going in that it's going to artificially shrink the pupil, right? So we want to look at these in normal room lighting. The pupil is going to tell us a little bit about the nervous system and how the nervous system is functioning in that moment. So if the pupil is naturally on the smaller side, we're not talking pinpoint here, but smaller, this is the parasympathetic nervous system kicking in full gear. That, of course, is the side of your nervous system that is all about rest, digest, and sex, right? It's just totally chill. We're totally relaxed. People who are parasympathetic like to be in control of their world to keep their world calm. They typically don't like things to be exciting or disruptive. Pupils can be small again because of the camera light. And so again, reminding you, we always want to look at these in normal room lighting. And when we are taking photos of darker irides like these, we want to change our camera settings as well and use a slower shutter speed. That will allow more light to hit the eye, and that will let us see more details in the eye as well. Again, the small pupils tell us this person just really likes to have things very calm. They are busy patting down the oceans on the wave because, or patting down the waves rather on the ocean, because they want that ocean to be nice and smooth. Right. And so as long as they are just gently patting things down and keeping all the ducks in a row and all the herbs on in the kitchen in alphabetical order, they're fine. As soon as someone swaps things around, messes up the alphabetical order, these people don't handle that well. They've lost control of their environment, and that's going to be a problem for them. So when you think about anatomy and physiology and the parasympathetic nervous system, what does the parasympathetic nervous system affect in the body? What do you think the parasympathetic nervous system affects in the body? I want to see some answers in the chat box. You can send it to me privately if you want. I should make sure that I've got this set up properly so that everyone can, there we go. Okay, so if you've got some ideas, go ahead and type them in. So we said rest, digest, and sex, right? So those are some that when the parasympathetic nervous system is working well, we digest better. The digestive tract, it does its peristalsis, it secretes digestive juices. When parasympathetic is working better, we sleep better, right? We can relax, we can shut off the brain, we can have things working properly here. Now, the exact opposite of this is mydriasis. So these are big pupils. Now, this we can actually assess from a photograph, because if we've got light going in and the pupils stay this big, then they would be even bigger without that light going in, right? Really common for children to have large pupils in normal light. Okay, everything in their world is exciting and new and maybe a little bit stressful. This is an indication that their sympathetic nervous system is working a little bit too hard or is working really hard. And so when we think about the sympathetic nervous system, that's fight, flight, freeze, or fawn, right? This is the deer in the headlights look. That's the freeze. This is the getting ready to slug somebody who just cut you off in traffic, a little road rage there. That is the sympathetic nervous system kicking into gear. When we've got large pupils like this, bright light will irritate their eyes. So getting photos of their eyes can be a little more challenging, because having that camera with that bright light really close can be very uncomfortable for them. When we have these large pupils, again, we're looking at sympathetic. So when we're in that fight, flight, freeze, or fawn, our bodies are, some parts of our body shut down, right? The digestion shuts down. That's a key thing. The heart rate will get faster. There'll be a lot of things kick in. Just think of how you feel when someone frightens you. They jump out from around a corner and they'll boo. And you know, what do? Your heart rate picks up, your respiration picks up. You might make a fist and maybe take a swing at them in self-defense, right? That's the mydriasis. It's interesting to know, though, that we also have mydriasis when we're looking at somebody we love. If we're looking at something we really like looking at, the pupils get big. So these pupils are slightly mydriatic. And so again, this person is someone who's just always a little bit on edge, waiting for the next crisis, really wants to be in control of whatever that crisis is, right? So again, digestion is going to slow down or shut off. Respiration is going to get faster and deeper. Blood pressure is going to go up, probably going to start sweating a little, right? All right, so now that we've had a quick introduction to pupils, at least the size, introducing myself. If you're new to me, welcome. Glad to have you on board. My name is Judith Cobb. I am a level 3 certified iridology instructor with the International Iridology Practitioners Association. And I've just recently applied for and was granted the sanctioned school status. So my courses have been recognized by IPA all along, but now they're listed on, I'm listed on the website as being a recognized school, which is kind of fun. In 2022, I was awarded the Instructor of the Year from IPA. And in 2024, I was awarded the Iridologist of the Year from IPA as well. I'm also a professional nutrition coach, and I'm associated with CanP and CanPro. And I'm a master herbalist associated with the Alberta Herbalist Association. I've been studying iridology and holistic health for 45 years. I know, it boggles my mind too. And I've studied under 10 different iridology instructors now. And I was one of the first 3 IPA instructors to certify at the level 3. Level 3 has only been around for a few years. I think it came up about 5 years ago. I was one of the first 3 to hop on board and get that certification as an instructor. Over all of these decades, I've written many books and taught many different kinds of courses, a lot to do with pregnancy and fertility and children's health, general health kinds of courses, biokinesiology. I was a certified prenatal educator for a little while. And I've written books to go with most of those courses, and my books are all out of print, except for the textbook we use for the dynamic iridology course. Dynamic iridology is what I call my IPA level 1 and level 2 curriculum. I teach level 1 and 2 intermixed, so that you don't just do level 1 and you can drop out. You've got to do the whole curriculum when you study with me, because that's how it makes more sense. All right, so back to the pupils. An ellipse, so an oval shape. Depending on which eye and which direction, when we see an ellipse, it can suggest an increased risk of bronchial issues, amongst other things. In order to assess ellipses correctly, you must know which eye and what direction the ellipse is pointing. So looking at an eye like this, I would want to know more about this person. I would want more history about this person. This is a left iris. I'm sorry, this is a right iris. This is a right iris. And this is it's pointing up to the client's left. So it's a left oblique iris. Now this is one of my clients who is a type 2 diabetic, and this person takes metformin, is not physically active, and is not willing to do any dietary work. Yeah, this person came in to see me for one appointment, mostly out of curiosity. And as we started talking about being type 2 diabetic and what the diet should look like, his answer was, oh, my wife is taking care of that. And the wife was taking care of it, but not in a way that was going to help reduce the impact of type 2 diabetes, right? And he wasn't willing to do anything else with it. When we look at these eyes, again, that ellipse does not tell us anything really about type 2 diabetes or about blood sugars and insulin responses. So again, this is a right iris and it's a left oblique. And that means we're going to look at the microscopic fine print here. I don't have every chart completely memorized. Weakness and motor disturbances in the lower extremities with possible paralysis, pains due to muscle spasms and extending from the buttocks down. So when we've got that left oblique, that can be an issue with weakness in the lower half of the body. It can also be an issue with respiratory stuff. So we just want to keep all of these things in mind, right? And we'll ask questions. The client may come in and may not have any symptoms that correlate with what we know can be possibilities here. That doesn't mean we don't want to ask questions. We want to understand, what is this person's history And what are they doing for their health? Because much of what we see with the pupil and with the sclera, we see before it becomes a clinical symptom. Here's another ellipse. Again, slight ellipse. This is a left eye, and we've got a right oblique. And so with the right oblique, we are looking at these maps and charts have microscopic fine print. I think it's literally a 4-point font. Anxiety states, neurosis, weeping spells, muscle spasms, tendency to cerebral hemorrhage and paralysis, and lower body weakness when we've got that right oblique. And so we want to be watching these things and not making our clients fearful, but asking information, asking about their health again, without asking questions that would be upsetting, right? We don't want to scare anybody, but we want to ask, do you ever feel like your legs are a little on the weak side? Right? And if she says yes, well, we see why here. And if she says no, then I'm going to recommend that she goes to someone who does spinal care and that she gets some work done and be consistent and persistent with that to eventually bring the pupils into round. The shape of the pupil is regulated by the nervous system. And so if the nervous system knows that the spine is misaligned and therefore the nerve feeds are being affected, the pupil will be out of round. Does that make sense? Ellipses are not all that common. You will more likely see flattenings. So where the pupil looks like something squished it. So it's not a flat side or 2 or 3 or 4. The position of the flattening shows the nerve feed challenges with organs that are adjacent and opposite. Okay, and so as we look at this eye specifically, again, this is a right eye, these flattenings suggest that the pituitary, kidney and adrenal and bladder and lung could be affected. This is a teenager. When we took these photos, she was a teenager. She was 16 years old, and she was a puffer-dependent asthmatic. And we see that clearly here. When we understand asthma, we know that it's an acid condition with being lymphatic over acid, uric acid predispositions with the hydrogenoid subtype and scurfrim. If you're brand new to iridology, those may not make sense to you yet. All of those things will contribute to asthma. And when we look at her lung reaction fields, we see that she also has that genetic tendency. So we've got several different indicators suggesting that she's at risk for asthma, and that is what she has manifest. And that is what we would need to work with then to begin correcting that and bringing her chemistry back into balance. More flattenings. So here we've got the inferior lateral and the inferior medial flattenings. Inferior medial tells us pancreas and liver are being affected, and inferior lateral is ovary. This is a young woman. She was 21 when she came to see me, and her symptoms and her lab tests all suggested that she has polycystic ovarian syndrome, which of course is pancreas, liver, and ovaries all together, right? And so we see that in the flattening. So in a case like this, yes, we'll recommend chiropractic or spinal care. We're also going to do a lot of work with her diet and get some appropriate supplementation happening there, because PCOS is not what this young lady wanted to have. Here again, we've got lots of flattenings. This is a 65-year-old female. And so in her right iris, we have the superior lateral flattening. In her left iris, we've got the superior medial and the inferior medial flattening. So superior lateral is pancreas again. Superior medial is pancreas again. And inferior medial is also pancreas. She's got 4 different flattenings that talk about pancreas. She's been a client of mine since she was one of my very first clients 45 years ago. So when she was coming in with this a few years back, she was coming in because she had gained weight. Her labs showed that she had elevated hemoglobin A1C, elevated triglycerides, elevated cholesterol. And so when we look at her eyes and we see all of the liver pigmentation in here, topostabile and topolabile in various forms, and when we see the lipemic diathesis, we know that her pancreas and liver have been very unhappy, right? We worked really, really hard with her, and she was a really good client. She's still alive, by the way. She's still around. And within the first 3 months of working with her, we helped her lose 20 pounds of the 30 that she had that she wanted to get rid of. And we totally brought her A1C, triglycerides, and cholesterol, and actually her blood pressure too, down into the normal range. She did the hard work. She did the very hard work. All right. So some people want to learn iridology just because they do, and that's great. And after they learn it, they find that it helps them in so many other ways. And here's just a few of them. It helps them to assess their clients more quickly. It helps them to be much more accurate. It helps them to build better and faster rapport because they are asking questions that connect the client's symptoms to the client's eyes and gives the practitioner the answers they need to be able to help their client more efficiently and effectively. And it eliminates the need for an intake form. Now, you will always need a release form, but the intake questionnaire that asks your client about everything they do and have done since they were born, waste of time, in my opinion. It's not useful, and it is truly a waste of time for your client and for you. Iridology helps us skip over needing that, and that's a good thing. The Dynamic Iridology Assessment System for Health Professionals is the only live, online, fully mentored course for nutritionists, herbalists, naturopaths, anybody who's got that college level anatomy and physiology under their belt and is working with clients or wants to work with clients in a holistic way. Learning iridology the way I teach it makes it so that you will not have to work unpaid overtime to do your iris assessments or to develop your client programs. I guarantee you, if you're spending time when you're not with your clients developing their programs, you're overwhelming your clients. You're giving them more than they can work with. By giving them exactly what they need in that moment, you will increase client compliance, which will increase their success, and that will increase your long-term retention of that client. So the next upcoming Dynamic Iridology Assessment System is starting on May 15th. And that course is actively enrolling now. You can see the URL on the screen. To speak with me about this course, I'm just going to pop that into the chat box so that everybody can grab that. There we go. If you don't already have that college level anatomy and physiology course under your belt, reach out to me and I will connect you with a course from a Canadian nutrition school that meets the requirements. The International Iridology Practitioners Association requires prospective iridologists to have a college level anatomy and physiology course before they can be certified as iridologists. And it's so much easier to learn iridology if you've got the A&P already under your belt. So there's a few call slots left. If you're interested in talking about enrolling in the May 15th start date, you can use that link that I've just posted in the chat box. This is what one of my students said. I asked Michelle, why did you enroll in my course? She came to me having been certified, at least levels 1, 2, and 3, maybe level 4 with David Pesic. And she had some other iridology certifications as well. But she came to me and she said, I wanted the latest info from an experienced practitioner that has used iridology in nutritional practice for a long time. Having my classroom at home allowed me to have all my charts and books by my side, made it easier, and having an awesome sharing and caring teacher made it the best. Judith helped me better my nutritional iridology practice. I recommend her courses to everyone. So she's a master herbalist, and you can see she's got a ton of paper on the wall, lots of certifications. Stephanie Morgan, another one of my students, I asked her, actually I didn't ask her, she volunteered this. So she said that she'd seen enough of the instructors online to know that, she says, you were the best teacher, the way you organize info, check for understanding, and coach your students. Other instructors know their stuff, but you have the heart of a teacher. I wanted to graduate with understanding, not just knowledge. Stephanie has a master's degree in education. Okay, so that meant a lot, saying that from her, saying that I have a heart of a teacher. I just have to praise my teacher for a minute. Those of you who know Judith from videos already recognize she is an amazing instructor. What you may not realize is that students and graduates have access to Judith and training videos and alumni even after the class is finished. She's a rare find in the under promise and over deliver. I am so thankful I was led to her website. So what would be included in the course? The course is 20 live 2.25 to 2.5 hour classes. We meet once a week as a cohort. All the students who are enrolled come to this session. Twice each month, we have a 1-hour group mentoring session, also done by webinar. This is optional. You don't have to come, but it's there for you if you want it. This mentoring is while you're in class, and as Stephanie Morgan said in her little blurb on the previous page, it's open to my graduates as well. Even once you're certified, you are welcome to come back to the mentoring sessions. I include my 225-page illustrated full-color digital downloadable textbook and 45 pages of cheat sheets or study notes. Think of those as Cole's notes or Cliff's notes. Every class session is recorded and is posted on your student site for you to access when you need to for review, or if you have to miss a class, it's there for you. The mentoring sessions are also recorded, so you can come back to those at a later date if you would like. I take no more than 10 students per class to ensure that you get the time you need to learn this well. One-on-one mentoring for certification preparation is also included for those who want to certify, right? And so if you decide you want to certify, you've got that A&P, you've done all the coursework as I've outlined it, then there is another mentoring step that I include to get you ready for the final exam. And it's also required by IPA that you have the mentoring time. So again, the next Dynamic Iridology course is starting on May 15th. And there is space in it still. And we've got the link in the chat box for anybody who is interested. So kind of a quiet group tonight. Just wondering if anyone's got any questions. I'll give people about 20 or 30 seconds to put something in there. So the underpinnings that I wanted you to pick up today, if it wasn't clear, is that the pupil is dynamic, and it is a reflection of what the nervous system knows. So if the nervous system knows something is out of balance and spinal alignment is out of balance, the nervous system would know that. That is reflected in the shape of the pupil and in the size of the pupil as well. And so very powerful information in the pupil. And it looks like there are no questions coming in. So we are having a short night tonight. Thank you for being with me, and I look forward to speaking with you soon. Take care. Have a great one. Bye for now.